At Des Moines University Clinic, you'll find healthcare professionals with only one priority: you, the patient. Come see us for the very best in family medicine, physical therapy, podiatric medicine, and osteopathic manual medicine. Call today to schedule an appointment.
Hello everyone, thank you for attending the 50 and Better Fair. My name is Ryan Starkman. I'm a second-year student here at Des Moines University, and I'm the current president of the Emergency Medicine Interest Group. And I'm here to talk to you guys a little bit about when you should go to the emergency department today. First, I'd like to start off by talking a little bit about the local emergency departments here in the Des Moines area. In the top right corner, you'll see Iowa Methodist Medical Center, which is a part of the Unity Point Health Des Moines. This is a level 1 trauma center as well as a level 2 stroke center, meaning that they are capable of handling any type of trauma as well as treating strokes. Unity Point also has Lutheran Hospital as well as Methodist West Hospital in their family. In the bottom left-hand corner is Mercy One Medical Center downtown. This is a level 1 stroke center as well as a level 2 trauma center, meaning that they are capable of treating strokes and are able to do a couple of advanced procedures as well as treating any type of trauma that comes in. Mercy One also has Mercy West in its family as well. In the top left-hand corner is Broadlawns. They also have an emergency department in town here that is capable of treating most medical emergencies. And finally, in the bottom right-hand corner is the VA hospital here in Des Moines. This hospital is specific for treating patients that are veterans, but are capable of transferring out to higher level care centers if needed. So now we're going to talk a little bit about what the emergency department is. The first thing I'd like to mention is that the ER is a safe place to be, whether you feel in danger physically, mentally, or any type of abuse is going on. We will not turn you away for anything. Each emergency department will have an ER physician on duty, as well as some nurse practitioners or physician assistants that are trained in emergency medicine. Every emergency room nurse is trained in advanced cardiac life support, and some are trained in advanced trauma life support as well. We understand that the word emergency means different things to different people and want to ensure that we take your emergency as our emergency as well. And every complaint that is brought into the ER is taken very seriously. For those of you that have been to the emergency department before, whether that was for yourself or with family, you have probably had to sit up in the waiting room. This can be a very frustrating thing as the wait times can be pretty long. This is not only frustrating for you, but it is also frustrating for staff, as we would like to get you seen as soon as possible. Unfortunately, the hospital is a very busy place and it is often completely filled, causing a backup into the emergency department. Those patients needing to be admitted often sit in emergency rooms for quite a while before they get a bed up in the hospital. This causes a significant backup as the emergency department can go from 30 beds down to 10 very quickly. This makes it sometimes very difficult to move patients efficiently. When you arrive at the hospital, an ER nurse will take you into the triage room and ask you about what symptoms you're having today and take your vital signs. Those patients with abnormal vital signs or certain symptoms will get to go back to the emergency department first. Some ERs have a fast track area where less sick patients can be seen very quickly and discharged home. This means that some of the less sick patients will get seen before some of the patients that fall in the middle ground that need to go back to the main emergency department. Again, we understand that this can be a very frustrating thing, but we want to ensure that your emergency is our emergency and we take all complaints very, very seriously. In the next few slides, I'm going to talk about some of the medical emergencies that need to be seen in the ER as soon as possible. All of these are time sensitive, and the quicker you get to the ER, the better the outcome. The first thing I'd like to talk about is a stroke. There are two types of strokes that can occur. The first one is an ischemic stroke, where there is either a blockage of arteries or a blood clot that travels up to the brain. This causes a lack of oxygen and causes part of the brain to start to die off. This is the type of stroke that, if caught early enough, can be treated with a medication called TPA in the emergency department. This medication breaks down blood clots and has been shown only to be beneficial if given within the first 4.5 hours of the onset of the stroke. The second type of stroke that can occur is a hemorrhagic stroke. This most often is caused by falls or trauma to the head, but can also be caused by brain aneurysms. The bleeding causes a lack of oxygen to the brain, as well as can put pressure on other parts of the brain, causing symptoms. The picture on your screen has the acronym BFAST on it. The B stands for balance, whether that's a loss of balance, a headache, or dizziness. E stands for eyes, and this can be blurred vision or loss of vision. The F stands for face, and that's one side of the face that ends up drooping, and this can be a telltale sign of a stroke. A stands for arms or legs, and that's where one arm or leg is weak or you can't move it. S stands for speech difficulty, whether that's trouble getting words out or gargled speech, or you can't get the correct word. And the T emphasizes time. If you experience any of these symptoms, it is important to get to the emergency department as quickly as possible, whether that's calling an ambulance or coming in through the front door. But one important thing to note is please do not drive yourself to the emergency department. The next thing we are going to talk about is chest pain. Chest pain is always an emergency, especially if you are over the age of 50. Although there are many different things that can cause chest pain, the biggest thing we worry about is a heart attack. A heart attack is caused by a blockage of the arteries in your heart, causing a lack of oxygen to the heart muscle. The heart muscle can survive for 30 minutes without oxygen, but it means that it is very important that you get to the ER as quickly as possible with any type of chest pain. Any type of pain in the jaw or the shoulders is considered chest pain in the ER, and you will have a cardiac workup done. Upon arriving to the ER, it is standard to get an EKG, which is a picture of your heart that will be seen by the doctor within the first couple of minutes. This is a great test to see if you are actively having a heart attack. If this is the case, you will be sent to the cath lab where the interventional cardiologist will attempt to place a stent to open back up the artery and return blood flow to the heart muscle. If this is done quickly enough, there will be less damage done to the heart and there will be a better prognosis. The important symptoms to look out for include chest pain, especially that is crushing or squeezing and can radiate into your jaw or arm or through to your back. Some of the associated symptoms include shortness of breath, nausea and vomiting, cold sweats, or a fast or irregular pulse. If you are experiencing any of these symptoms, don't hesitate to seek out medical assistance. A reminder to not drive yourself to the emergency department if you are having any of these symptoms. We are now going to be talking about falls. One of the biggest issues about falls, especially for those that are living independently, is the ability to reach help after this has occurred. Devices such as Life Alert and even some of the new high-tech watches are extremely useful in notifying authorities or family members when you have fallen or are in trouble. These have saved many people's lives, and I highly suggest having a plan in case you fall. Nobody plans on falling, but being prepared in case it happens can make a huge difference in the outcome. There are two significant injuries that we worry about with falls. The first and most time-sensitive is a head injury. Falling and hitting your head can cause bleeding in the brain. This is especially the case if you are on medications such as warfarin or Coumadin, Plavix, Eliquis, Xarelto, Relenta, or Pradaxa, or any other medications that is labeled as a blood thinner. The second major injury is a lower extremity injury such as a hip or pelvis fracture or femur fracture. These types of injuries make it difficult to move from the place that you fell and can cause issues with reaching out for help. As stated before, having a plan in case you fall can make a drastic difference in the outcome. I now want to say a few words about the current situation with the COVID-19 pandemic. We are learning new things every day about this virus, and there is unfortunately a lot of misinformation floating around. This is a serious disease, especially in your age group. The signs and symptoms are very broad and include fever, fatigue, dry cough, aches and pains, runny nose, loss of smell, sore throat, shortness of breath, and diarrhea, just to name a few. It is also true that many people don't have any symptoms and can spread the disease without knowing they even have it. This makes it extremely difficult to pick out who is possibly infected and who isn't, just by looking at symptoms and vital signs. This being said, every person that walks into the emergency department is treated as if they are positive for COVID-19, and precautions such as gowning, gloving, face masks are being used in order to prevent or eliminate the threat of spreading the disease to other patients or employees. The staff has been heavily trained in infection prevention and in order to minimize the chance of any other patient getting infected by coming in to be evaluated for their emergency. This being said, I want to ensure you that every possible thing is being done for your safety and that it is not dangerous to come to the emergency department if you feel like you are having an emergency, whatever that might be. There are a few simple things that each of you can do to make sure you and your family are safe. If you do go out in public, be sure to wear your mask in indoor spaces. Try to shop in bulk in order to limit the number of times you need to go to the store. Instead of multiple people going to the store, try to limit it to one person to decrease the chance of infection. Many stores have developed shopping hours for those over a certain age or those that are immunocompromised. Take advantage of this if at all possible. If you have a family member that is willing to pick up groceries for you, this is the best option. Always social distance and make sure to continue being diligent with washing your hands. And this concludes the presentation. Feel free to reach out to me with any questions via email, which is listed below, and I hope you guys have a good rest of the day. Thank you.
At Des Moines University's Family Medicine Clinic, our goal is to provide you with compassionate care that is comprehensive. From caring for children to the elderly, our medical team provides holistic preventative guidance on how you and your family can maintain a healthy lifestyle and manage any symptoms that may arise so that you can be at your best. During the current COVID-19 pandemic, maintaining your health as well as a safe lifestyle has never been more important. Our providers are here to help when acute conditions affect you or your family. We treat musculoskeletal injuries, infections, illnesses, and many other medical conditions. As an academic medical center, DMU is training tomorrow's healthcare providers on how to provide expert care to people from all backgrounds. We invite you to visit the Family Medicine Clinic at Des Moines University. We offer the care and attention you deserve.